Hello, everyone. I'm Marcia McNutt, and welcome back to today's symposium on strategic planning for crises, with particular focus on COVID-19. I'm Marcia McNutt, president of the NAS, and it's my privilege to moderate this final panel on the use of scenario development in order to be better prepared for an uncertain future with COVID. I'd like to turn now to my panelists for them to each introduce themselves before I give some opening remarks about the topic of this panel. So Karen, why don't you begin?
Hi, everyone. My name is Karen Dynan. I am an economist by training, and I am currently a professor of the practice at the Harvard University Economics Department and at the Harvard Kennedy School. And I spent most of my career before coming to Harvard in policy jobs in Washington, D.C., most recently as the Assistant Secretary for Economic Policy at the U.S. Treasury Department.
Okay, Gary, you're up.
Hello, everyone. My name is Gary Machlis. I'm University Professor of Environmental Sustainability at Clemson University. And prior to that, I served both terms in the Obama administration as science advisor to the director of the National Park Service and co-led the development of the strategic science group that collected for Department of Interior leadership interdisciplinary scenarios related to Deepwater Horizon and Hurricane Sandy.
Thanks, Gary. Okay, John, let's go to you.
Good afternoon. I'm John Lumpkin. I'm an emergency physician by training and formerly the director of the Illinois Department of Public Health. Currently, I am vice president for Drivers of Health Strategy at Blue Cross of North Carolina, and I also am president of the Blue Cross North Carolina Foundation.
Thank you, John. Okay, Janet, to you.
Good afternoon, everybody. My name's Janet Napolitano. I've had a long and varied career in public service and now in academia. I began as the U.S. Attorney and Attorney General for Arizona. I was the two-term governor of Arizona. I was then appointed by President Obama to serve as his Secretary of Homeland Security, which I did for about 5 years. And then I joined the University of California as the system-wide president of the university. And beginning this past fall, I joined the faculty at the Goldman School of Public Policy at UC Berkeley, where I'm currently serving as a professor.
All right. Thank you, panelists, for those introductions. So I was listening to the previous panels and I realized that the one that Bill Press chaired set us up perfectly for this conversation. I took notes here that Mayor Durkin said, while everyone is worrying about what's happening now, no one is worrying about what are the next 5 problems that we need to deal with in terms of this pandemic. And that reminded me of a very famous quote from the physicist Niels Bohr, who said, "Prediction is very difficult, especially about the future." So when you face an uncertain future with a pandemic, what tools are available to look into the future to see what you might have to deal with and how you can be resilient to it, but and do it in such a way that you aren't constantly fighting the last battle, that you aren't relitigating the 1918 flu or Ebola, because each pandemic will be different and you have to be prepared for what could come down the road in the future. Well, in Bill's panel, Nicole Lurie already dropped the idea of the importance of scenario planning. Scenario planning so that you can be prepared for that uncertain future and you can identify single points of failure that would actually cause huge disruptions, such as she said, the single point of failure with the US testing protocol. So if I could have my first slide, please. What I've done here is a quick 1-slide summary of Martin Sepúlveda's excellent presentation, which was available online. But since I know not all of you are overachievers and looked at all the videos before the panels, I'm going to do a quick summary of it. So basically, this chart shows the basic principle of scenario planning. That scenario planning is trying to understand what possible futures do we need to anticipate when the future is dictated by forces beyond our control. So in this case, I've chosen two axes that are outside of our control as scientists or perhaps even as individual members of society, but could lead to very different futures. On one axis, I put, what is the virus doing? At the top of that, I say it's a one and done. It's a simple virus. We develop a vaccine. The vaccine works, and that's it. But on the other end of that arrow is the possibility that the virus could be constantly mutating to vaccine-resistant forms. We heard in the last panel about the fear that it becomes like the flu, constantly changing, coming back every year, and in a form that is not addressed by last year's vaccine. And then the horizontal axis I have here is, how does society respond to complex challenges? Is society very proactive, masking, social distancing, washing hands and making sure that everyone gets vaccinated? Or is it reactive to challenges, that people refuse to take precautions until they are personally affected by it? So if you look at the spaces that are divided by these by these two lines, we have four quadrants. Scenario 1 and scenario 4 are quadrants where the virus is actually acting in a very easy way, but society could either be proactive or reactive. The lower two quadrants, scenario 2 and scenario 3, are a very difficult virus to deal with, but society either could be proactive or reactive. And of course, we could put different countries around the globe in either scenario 1 and scenario 2, or in scenario 3 and scenario 4, depending on how the people of that nation respond. So once these scenarios are defined, then the next thing that happens is different teams of researchers who are broadly constituted across the life, social, policy worlds, will indicate what would be resilient actions we could take right now if we found ourselves either in scenario 3 or scenario 4 or scenario 2, etc. What are the resilient things we should be doing now? And what usually comes out of this scenario planning is that interventions that are useful in one quadrant end up popping up in other quadrants. So those are the no regrets actions that we should be taking now in the face of an uncertain future to make sure that we don't have a cascade of negative consequences. So with that introduction, I'd like to turn first to Karen, because Karen has led the first scenario that the academies are developing on rental evictions. So Karen, the floor is yours. Tell us a little bit about this work.
Thanks very much, Marcia. So I'm going to start with a few words about the importance of the work of this strategy group, the topic that we are addressing. So we've been grappling with the task of producing a set of actionable recommendations that will reduce and mitigate the wave of rental evictions that may result from the COVID-19 pandemic. So we've seen considerable job loss, and we've seen much income replaced by government interventions as yet. But more importantly, rental evictions have not been a problem as yet because the federal government and many states and localities have had moratoriums on rental evictions. But the federal moratorium on evictions will be lifted at the end of June, And estimates suggest that notwithstanding all the government support that we have seen so far, more than 10 million renters are currently late on payments, with the typical delinquent renter owing something like $6,000 in back rent. Okay, so hence the fear that this is going to result in a wave of evictions from rental properties. Now, the good news has been that recent fiscal packages have passed a substantial amount of funding that states can use to help distressed renters. However, particularly given what's at stake, we cannot take it for granted that this money will solve the problem. The federal government needs to get the money to states, and then the states need to get money to the right people. And as we are trying to help distressed homeowners in the Great Recession, people who are having problems with their mortgages, states have very different capacity in terms of their ability to reach the right people at the right time. So this is all what the group is working on to put together this package of recommendations. And just to build on what Marcia was saying, setting up this panel, scenario planning really was the right tool to be using for this exercise. I should say I spent much of my career in organizations that at the time were making policies around a single baseline forecast, which is an approach that serves us well in normal times. But that approach just isn't suited for times when there are considerable uncertainties about where we're headed, such that the best package of policy is one that is going to be robust to a range of plausible scenarios. So our group considered 4 scenarios that reflected different mixes of outcomes in terms of how the virus plays out and in terms of what other disruptors might arise and how they would be responded to by society and the government. And we went all the way from a world where there was an effective response to the virus and external disruptors were not a big issue, to a world where policy responses were fragmented and there's an onslaught of external disruptors. So these scenarios were just meant to be examples to focus the group. It was a tool, as Marcia described. We did not literally craft recommendations for each scenario, but it proved to be a useful tool for getting the group to stretch their thinking in terms of the right, robust package of actions to be taken. Now, unfortunately, I cannot tell you the results of the report since it is still in review, but I do want to just close out by offering 3 of the lessons that we learned with the first strategy group. And the first is that it turned out to be very important to have a large strategy group that spanned many disciplines and mixed both academic experts with practitioners. So the rental evictions issue it's very complicated. It has numerous stakeholders, and there's going to need to be quick policy turnaround. So it was just essential to have people with knowledge about institutions and the real world challenges that renters, landlords, and communities face. We also heard from people with lived experiences, who were facing eviction from their rental properties, on how they saw the causes and the solutions to housing stability and the costs of housing stability. So that's the first lesson. The second lesson is that it's actually been really challenging to adapt processes such that we move with the necessary speed while still preserving the key hallmarks of academy work. So, we're looking for objective, independent, evidence-based analysis. We want to have a rigorous review process. We want to have actionable recommendations. And as we were kind of working with the group, we learned a lot about what worked and what didn't, and we'll be building that into processes for future strategy groups. The third lesson builds off the second, which is the importance of managing the scope of the process. In our case, we knew the primary task was to address the acute wave of housing instability that may be arising from the COVID pandemic. But the fact is, we know that there is way too much housing instability for renters on a longer term basis, and that those longer term problems exacerbate the shorter term problems. So a key lesson we learned was figuring out where to draw the line is going to be essential to ensuring that turnaround is sufficiently rapid. So those are my 3 lessons. And I guess the last thing I just want to do is to thank Marcia for her leadership, to thank everyone for their huge efforts. Our strategy group members spent many hours helping us. And I think that the Academy's staff spent what you literally might call countless hours pulling this all together. So I'll leave it there.
All right. Thank you, Karen. That was a wonderful summary. I think it's going to be interesting to go now to Gary, because your scenario is something that I think everyone can recognize as an important one, because all of us either know someone who's facing housing insecurity, or we hear about it on the news, etc. But now Gary is planning a second scenario, and this is one on ecosystem services. And I think Gary's situation is one that maybe is not first and foremost on the minds of Americans, but perhaps it should be. So Gary, tell us what you're thinking.
Thank you, Marcia. It is plausible and sobering that the economic and social disruptions caused by the global COVID-19 pandemic are the largest and most systemic since World War II. There was the ubiquitous blackout curtains, and now the mask. There was the rationing card for sugar and meat and petrol, now matched by the grocery sign that says limit 3 per customer. And then there is the immense death of civilians. Now, I do not mean that they are comparable, but they are equally cruel. This very morning, the Johns Hopkins Coronavirus Resource Center reported that we have crossed over past 3 million global dead. Here's a standard definition of ecosystem services, which forms the basis of the scenario work we're planning. It includes a scenario of how the COVID-19 disruptions may impact ecosystem services over the midterm, 5 to 10 years, and what the implications are for sustainability and resilience using the standard definition. There are some evidence-based clues. City lockdowns here, Rome, Madrid, New York, and Delhi, have led to significant declines in nitrogen dioxide concentrations. In India, the particulate matter and soot declined 25 to 30%. The result was a decline in soot and particulate deposits on the snows of the Himalayas that led to an increase in albedo, increasing the reflectivity of solar radiation, and markedly slowing snowmelt, altering the timing and levels of water supply for millions of people downstream. The volume of PPE waste created by the COVID-19 precautions overwhelmed waste management capacities in many countries and has led to significant shoreline and marine pollution. Oceanasia estimates an astounding 1.56 billion face masks, that's 4 to 6 million metric tons, entered the oceans in 2020 alone. Some of the effects of the COVID-19 disruptions have actually been positive to ecosystem services, though the trends are unclear. In Phuket, Thailand, beach closures and the abrupt disappearance of tourists have seen a thriving hatchling season of leatherback turtles, these are in the Muang Sanctuary in Phuket, that have returned to the tourist abandoned beaches. Yet in parts of West Africa, the absence of safaris and the loss of income has reduced wildlife patrols and led to increased poaching. Available data suggest a complex and extremely fluid set of drivers impacting ecosystem services. And that should not surprise us, given, as Marcia and others have said, the disruptions themselves remain complex and fluid. Hence, there are some significant challenges to the ecosystem services scenario that we need to pay attention to. We're going to have to distinguish between what are temporary disruptions and changes, what are transitional to a new future, and what are deeply structural changes. We need to identify causal pathways to avoid spurious correlations, and that means being extremely careful on the chain of consequences linking these changes to COVID-19 disruptions. To have an evidence-based scenario requires high-quality data at the appropriate scales on which you are examining ecosystems. And we need to identify key uncertainties all along the chain of consequences and the uncertainties underlying the assumptions that the scenario must necessarily make. And all of that to describe potential policy and management responses. These responses are critical, for we depend on ecosystem services for whatever resilience our species may have. And the fate of ecosystems is our own. Thanks.
Gary, that was wonderful. Your opening about the comparison of COVID to World War II was actually very apt. Earlier today, I showed a slide from The Guardian that shows that the annual death toll from COVID-19 has surpassed World War I, World War II, and the Civil War in terms of its impact in the US. So, John, I'd like to turn to you next. You are responsible for a massive healthcare organization. What are your views on these scenario developments, and how do you think they can help the American healthcare industry?
Great. Thank you, Marcia. And, this has been a trying time for healthcare. We've seen hospitals and healthcare providers who've been overwhelmed by wave after wave of this pandemic. And at the same time, during the ebbs, they've had to play catch up with many of the preventive services that are required to mitigate the impact of delayed service and foregone analysis and identification of cancer and other diseases. The public health system has been overwhelmed by COVID. First, in understanding the epidemiology. And this is a system that was devastated in the economic downturn of 2008 and 2010, through 2008 and 2009, when over 60,000 local health department employees were let go as part of that economic downturn. And that workforce was never replaced. The challenge of getting out the messages about what are the public health steps in the midst of a politically charged environment, and then setting up one of the largest vaccination campaigns in our nation history. I know from having been on those front lines that too often we look down, not down the road, but to the next patient, the next crest of the pandemic. Yet we don't have time to look at what the trends will be. What will be the impact 12 months, 18 months down the road? We just heard from Karen about the impact of what will be happening related to evictions. And at the same time, evictions are associated with increased use of emergency department and other healthcare services. We heard from Gary about the impact upon the environmental services, the eco services, and we know that that has a direct impact on health, such as asthma and other diseases, and that they disproportionately impact communities of color. What has been outstanding about this process is that when we understand that health is about more than healthcare, and the decisions that need to be made in the healthcare setting and the public healthcare setting are so much determined by factors that are beyond the control of those same systems. That is exactly the kind of setting, as Marcia talked about, that are important to consider scenario planning. And what the National Academies did in establishing this process was create a parallel process, a process where each of the academies were setting up committees to address the immediate impact of COVID. What do we need to do to think about with vaccinations? What should we be thinking about treatment? What treatment works, what doesn't? At the same time, this Response and Resilient Recovery Strategic Science Initiative was setting aside effort within the academies to think down that 12 to 18-month path. And I think that we can demonstrate that this will have a positive impact. In addition, once the reports are prepared, it will be critical for all the academies to look at those reports and the scenarios and the trends to identify the impact. It will have an impact upon where I work at Blue Cross of North Carolina. If we can expect increased evictions, we have to think about the non-clinical drivers of health, those social determinants of health that will be impacted by each one of these scenarios. So it's been a pleasure to work with such a talented crew, because the multidisciplinary approach that was taken in this panel enabled different perspectives, from the ecology to the environment to the legal and regulatory, as well as the housing and economic aspect. And that is always a critical, important component of looking and trying to peer into not the future, but the potential futures, and with the scenario process, determine what steps may best prepare us and position us to be able to protect the health and well-being of everyone in our nation.
Wonderful, John. Thank you so much. And now I'd like to turn from the actual focus, maybe just on this current crisis, to Janet, who has certainly been on the front lines of many crises before this, and get some higher level view of this scenario resilient recovery framework, and what your thoughts are for how we can benefit from using it.
Thanks, Marcia, and thanks to Karen and Gary and John. It's been such a pleasure serving on the steering committee with you for the scenario planning initiative. And I hearken back to my time as a governor and as Secretary of Homeland Security. When you're dealing with a crisis and you are in a leadership position, you are at some point overwhelmed with coping with the immediate impacts. And you really, you kind of know in the back of your head that there's a future out there, but you don't really have oftentimes the capacity to even think about it. You know, the topic of housing and evictions. Housing is one of the most complicated public policy areas that we have in our country, overlaying jurisdictions, regulatory and legal requirements, and by the way, a direct relationship to the homelessness issue that is an impact of eviction. Ecosystem management, so very, very important. My first exposure to this kind of scenario planning was in managing the Deepwater Horizon oil spill in the Gulf of Mexico, working with the Department of Interior, the EPA, the White House, the Coast Guard, and then the state and local jurisdictions, as well as with BP to identify how to put a stop to that gush of oil at the bottom of the Gulf. and also to deal with all of the impacts experienced in the coastal states that were in the immediate area of the spill. Here's the thing. This kind of a process conducted by folks, experts from academia, but also practitioners who can have a robust engagement that can help think through and plan ahead and raise, like, you need to think about this, and you need to think about this, and you need to think about that. And here are interventions that you can put into place that will help mitigate future harm. And that will help refocus leadership, not just on dealing with the crisis of the day, but mitigating the future crises that can occur unless you do something like scenario planning. So to have the Academy put its weight and its processes behind this sort of exercise is a wonderful contribution to future crisis response and planning in the United States. I dare say it would have been a real help to me as a governor dealing with, I was in Arizona, we had a migrant crisis at the border, we had major forest fires, we were accepting and accepted refugees from Katrina who would arrive in Arizona on almost unannounced on a plane and get disloaded at the airport. So to have at my fingertips the kind of scenario planning, both the substance of it and the process of it, would have been quite advantageous. And certainly as Secretary of Homeland Security, which is a crisis job, leaning forward and thinking toward the future and not just being reactive, but proactive, as Marcia's chart showed, would make for a much stronger Homeland Security enterprise for the nation. So I think that as these scenarios get completed, as the reports get produced, we need to really spend some time making sure that the public leadership of the country, the mayor of Seattle, to the Secretary of Homeland Security and everybody in between has access to them.
Wonderful, Janet. Thank you very much. So now we're going to launch into some Q&A. So if anyone out there wants to send some questions, please send them in. Has Martín Sepúlveda joined us? Martín is our fearless leader in this Response and Resilient Recovery Strategic Science Initiative at the Academy. I hope you saw his video that he pre-recorded. But in any case, Martín was hoping to join us for the Q&A. And so please let him in. But in the meantime, I have a question. This is really probably mostly directed at Gary and John, but if anyone else wants to weigh in, that would be great. Gary and John, you both talked about situations where people are worried about the near term and maybe not focusing enough on longer term cascading consequences. In this particular case of COVID-19, and let's take Gary's picture of the plastic that and all the trash that's going into the ocean from personal protective equipment. How do we weigh the cost benefit of the near-term reduction in infections by encouraging the use of PPE versus the longer-term problems that massive use of PPE and then poor disposal has for the ecosystem services, without which, of course, this planet becomes uninhabitable. So do either of you want to attack that one? Gary, you look like you're ready to jump up.
And this borrows from Janet's wisdom about thinking 5 steps ahead. The very moment we knew we needed to ubiquitously wear masks, the waste management systems of the United States should have been armed with scenarios. What's going to happen downstream? And the design and creation of these masks should have been done in such a way that they minimize the long-term pollutants, microplastics, for example, and the waste management systems should have been given a burst of engineering, a burst of science, a burst of support to get ready for what was obviously, and I mean it metaphorically, downstream. And so I think the 5 steps ahead, the potential unintended consequences, and the quick movement to realize if we have a health problem, we also have a waste management problem.
Excellent. I agree. John, do you want to add anything more before I go to audience questions?
Absolutely. And, you know, it's the old adage, when is the best time to plant a tree? 20 years ago. When's the second best time? Today. We knew for 100 years that we would have another pandemic, but we always thought it was going to happen on someone else's watch. And I think one of the greatest lessons out of this pandemic is that all of us, including the academies, should actively engage in scenario planning. So we're asking the questions, and then what? And then what do we do? And then what should we do? You know, Gary's example of PPE and what will happen with that is a perfect example. But another one is, you know, hospitals and other healthcare providers have been actively engaged in just-in-time inventory management. And we never asked the question, what will happen if there's a pandemic? We need to start asking those questions more. And then secondarily, when a major event occurs, a pandemic, a major drought, the process of setting up a scenario planning process at the same time as the response is critical. To bifurcate those two activities so we're not only thinking about what to do next, but what to do after that, after that, after that.
Good, John. Yes, so the framework that we've used at the Academy is we wall off the actionable science delivery, which is the just-in-time advice on wearing masks and crisis standards of care and the value of social distancing. We wall that off from the strategic to make sure that neither one is getting shortcut. And I love your analogy of people always assuming it will happen sometime, but not on their watch. I think anyone involved in crisis management or the use of science in crisis, you should all have something on your desk that says it is your watch. And so that we're always prepared for that. One other thing I'll mention is I saw this fabulous little sign at my grandchild's preschool that said, treat your mask like you do your underwear. And all the kids had cloth masks and they were being encouraged to make sure they got washed every day and that you had a clean mask when you went to school. And I thought, wow, you know, the preschoolers get this. Why don't the rest of us understand that cloth reusable masks washed every day are a great solution? So let me go to some of the questions that are coming in. I've got one here. One of our viewers is asking, how can the results of scenario planning become a fixed part of the federal government's activities so that it can't be canceled by a future leader? Maybe Janet, that one's for you.
Yeah, that sounds like a Janet question. That's tough because, you know, under our system, things that are done by the executive branch can be undone by a succeeding executive branch. If things are actually put in formal regulation or statute, it's much more difficult to undo them. If something is an actual regulation, to undo that regulation, you actually have to do another whole notice and comment period and the like. And of course, doing anything through Congress is extraordinarily difficult. And so, you know, I think the easy answer would be if scenario planning leads to concrete recommendations for mitigation, et cetera, is to attempt to put them into regulation, if not statute. But I would also say that we need to imbue our civil servants, the career civil servants, with the values inherent in scenario planning, because career civil servants are a wonderful resource in this country, and they don't change from administration to administration. And so having a dedicated kind of reach out into the civil servant community, career civil servant community, would be another recommendation.
And just to echo that, having spent so many years at different government agencies, I think culture, I think you're just right about that, Janet. I mean, these government agencies are staffed up with technocrats who are natural candidates to be doing this analysis, and we need like a cultural change that just, you know, just changes the way they do normal business and how they think about it.
Yeah, good point. John, did you have something you wanted to add to that?
I would just add to that the role of science is so critical, and particularly science out in the public. And that is why the role of the National Academies is critical as a process and a place where that scientific discussion can occur, which sometimes can be challenging within agencies, but it creates a check and balance, and I think a very important one.
Yeah, good. And Gary, you've got something. Yeah.
If Katrina and Hurricane Maria taught us anything, it is not to rely on the federal government to be the source of restoration and response. And I think governments at the different levels, when county governments start to do scenario planning, when independent universities do scenario planning for the local regions that they have built trust and experience on, when all of that starts to happen and we don't just focus on the federal government, I believe we'll have a more resilient scenario ability to respond to the next crises.
Yeah, I think that's a good point, Gary. I once was part of a panel that was at an organization in which there are leaders for county and local government were all participating in this meeting, and it was an association that they all belonged to. And we were talking about the science capacity. And of course, the federal government has immense science capacity because there are scientists embedded in almost nearly all of the agencies. But when you get to the city and county level, they do not employ reams of scientists to do the kind of advising they need. So we discussed on this panel, what are options to get better locally valid science into the planning for states and counties. And we concluded, just as you did, Gary, that there are so many community colleges and local universities that do have capacity, even industry that has a number of wonderful scientists that would be very interested about local impacts. So I think that's a good suggestion. I think one thing that the Academy can do is perhaps show the value of this sort of engagement so that other groups feel that it is definitely cost effective to put the time and effort into it. So I've got another question now. And this one is maybe for John, but maybe Karen would want to comment on it too. And that is this concept of just-in-time inventory. Obviously, everyone bought into it because we're involved in this global competition, and just-in-time inventory was the way to be competitive. So if just-in-time inventory clearly got us into trouble with not having stockpiled what we needed for an emergency, how do we get around that, given that we're still embedded in this global competition and any one nation could decide not to do it and undercut American commerce?
So I'm looking at The Economist, but I will toss in my hat into this discussion. You know, from my years in government, part of that is the role of government to look at that. And, you know, under, you know, Janet's leadership and others, we created a national stockpile that was available for response to a bioterrorism event, for response to any major health event. I think we need to reassess that, because in a sense, if we want our businesses to be able to be competitive on a national scale, yet at the same time, there's a national interest in us being able to respond, then there's a logical role for government in making sure that we have that surge capacity to be able to do that kind of response.
So now let's turn to The Economist to see what she has to say.
Certainly right. Supply chain issues have been just, you know, huge during the pandemic, and huge in a way that not only affected kind of just, you know, what we as consumers can consume, as John would say. I mean, they've been huge in our ability to fight the virus. I agree with John that there's a role for government here. I am hoping that it will be taken as a lesson learned. I suspect we will see companies diversify their supply chain coming out of this. I guess part of what makes me hopeful is we did see, you know, we had this terrible financial crisis a dozen years ago, and we did see both companies, but also importantly, government adapt such that we actually didn't see a financial crisis with the pandemic coming upon us. We actually almost, if you were a student of financial markets, you know, we almost did, but the government responded much more swiftly, taking measures they never would have been able to take if we hadn't had the global financial crisis. So I hope it is something I think the government needs to be doing. And I hope it is a lesson taken from this crisis.
Great.
Marcia, let me, might I add a comment to that?
Sure.
First, on just-in-time inventories, one of the downstream impacts is on shipping. And we now have the development of these mega container ships, like the one that plugged up the Suez Canal for a week. We've had to create additions not only to the Suez Canal, but the Panama Canal. The major ports along the eastern seaboard of the United States have had to be dredged and made deeper for the deeper holes. Then you have to have the development of these huge cranes that can unload these containers, et cetera. So I think we're going to have to ask a question in addition to the necessity of having a stockpile, how the just-in-time inventories connect with shipping, and when are ships just too big? to be managed around the globe. And with respect to the stockpile, I would also add that it was a constant struggle to get Congress to appropriate enough funds for a sufficient stockpile. There were some decisions made about what would be in the stockpile. What would be the key crisis that it would need to be prepared for. And so during the years of the Trump administration, they focused on a stockpile in case there was an anthrax attack. Anthrax attack, very different from COVID. And so all things that need to be taken into account in terms of our future resilience.
Yeah.
Marcia?
Yeah. Yes,
Marcia?
Gary. Yeah.
What would happen if critical stockpiles were treated as an accepted and integral part of the nation's infrastructure?
Yeah. Yeah. So
Not a side gig, not a
Yeah.
thing at the very end that you realize when it's an emergency, but we build a bridge, we build a railroad, we build a stockpile, that the stockpile is actually infrastructure.
Yeah. So I think, Gary, the point you're bringing up would be well worth a really in-depth academy study. Because as Janet just said, you have to know exactly what to stockpile. So figuring out ahead of time what kinds of issues are going to bring you to your knees would be the first step. And black swan things like that ship getting stuck in the Suez. I mean, what kind of person was at the wheel that day? You know, these are huge ships. And he said, oh, my bow got blown into the bank. Okay. All right. So anyway, I think the difficult thing would be figuring out what is needed to be stockpiled. And then also, how do we constantly renew that stockpile such that when we're delivering things, we're taking the oldest out first, sort of like the salad in your refrigerator. You know, you eat the oldest one first. How are we constantly taking the things that are about to spoil or about to go bad or about to be supplanted by new technology and get rid of those so it doesn't become something static that we turn around and say, oh, we've suddenly got this event. Let's go to the stockpile. And you look in the stockpile and there's nothing worth using. So I think
as the national conversation and the bills working through Congress on infrastructure happen right now is the time for stockpiles to be considered in all those conversations.
Yeah, right.
Gary's making an excellent point that this needs to be viewed as an investment, just like infrastructure is an investment. And with government borrowing costs at kind of rock bottom levels, it just, you know, and now that we understand what's at stake, it does seem like a no-brainer.
So let me turn to another question for you all, and that is the following. Karen, you're involved right now in the rental eviction. Gary, you're involved in the ecosystem services. But what do each of you think? I mean, this is one of those situations where the art in all of this is what question you address. So what do each of you think right now is the next most important scenario that we should be considering in order to be prepared for what are potential cascading consequences of this pandemic?
Karen.
So do you so do you mean within the rental evictions area or just
no, just if you were to pick another topic, not
yes.
rent, not eviction, not ecosystem services. You know, we can't address a problem that we haven't thought about.
Yeah.
So what do you think is the next one?
I think I'm going to speak as an economist. I think there's been a lot of talk, and I actually agree with this, that our economy in this country is heading, for a recovery this year, a very strong recovery as people are vaccinated. And, now, speaking of stockpiles, people have all these kind of financial resources. They're going to be out there kind of buying. But I don't think we should take it for granted that's going to map into an economic recovery for the entire population. And I think people are just assuming, oh, now we can go back and we can consume services again. All those people, many of whom are kind of low wage workers who have been displaced in the services industry, they're just, they're going to be hired and their jobs are going to come back. And I don't think we can take that for granted. We don't know. We think firms automated during the pandemic, firms whose workers were laid off. So we don't know that these jobs are going to be recreated. We had many small businesses fail. So there's work there to replace them with new small businesses. So I think the thing we should be focused on is kind of what if the recovery isn't shared broadly? I mean, what if many of us experience recovery, but what happens to people and families that were left behind, and what do we do for them?
Okay, great. Thanks, Karen. So we've got a minute each for the rest of you to give me your 1 minute synopsis of what you think is the next problem we need to be addressing. So Gary, are you ready to go?
Yes. I believe that COVID-19 has been an extraordinary, massive, natural experiment in how we do education in the United States, K through 12 as well as higher education. And we need to figure out what are the permanent effects, what are the transitions, and what are the temporary effects of this massive change and disruption on our education system. And then we've got to deal with the outcomes that emerge from that. So I would think the impact of COVID-19 on education and separating out what is transitional from structural and what the outcomes are.
Perfect. All right. Janet?
I think we should ask ourselves, what if there were some way to effectively deal with misinformation, disinformation on social media? What is that a government issue? Is it a private sector issue? Is there a way to better curate information that is commonly available and that is causing, I think, and leading to so many people resisting vaccination even now? So dealing with the whole social media Gordian knot, I think, is a worthy endeavor.
I love that one. A topic very near and dear to my heart. Okay, John, we're going to give you the last word here.
Great. And I'm going to delve in. I think that one of the biggest lessons is the impact of decades and centuries of racial inequity in the society has resulted in a disequitable toll upon people of color. And that that we need to look at what are the ways that we can create more resilient communities by having a more equitable society.
That's perfect. So I see Martín Sepúlveda, who is the leader of this wonderful scenario planning group. Martín, do you have any final words before I close this out?
Let me just share with everyone who is participating that Marcia's introduction of this particular tool to extend thinking beyond normal processes and methodologies was incredibly well received. The people who you've heard from in this panel and those whom you haven't have taken insights and experiences and started to share those, within their networks. And we would encourage all of you to do the same. Thank you for joining this marvelous panel.
Well, thank you, Martín, for your leadership. And I want to thank all of the panelists for this panel, and actually all of the discussion leaders and panelists that we've had all day. This has truly been a pleasure. I have learned so much. And now it's time to close out the symposium for the NAS annual meeting. Thank you for everyone who tuned in. Okay, and we'll see you tomorrow.